Today we're going to be talking about the dressing that you will be wearing after you have this surgery. There are basically three types of dressing. One would just be a cotton ball in the ear with maybe a band-aid over that to hold it in. And that's if we have not had to make an outside incision. If we make an outside incision, then we put an outside dressing on which covers the entire ear and the incision area. It's also wrapped around the head in order to hold it in place. It's important that we have the dressings on to catch any drainage that may occur. Many times the dressing can be removed the following day. However, this is something that you need to discuss with your surgeon, as they may want you to keep it on a little bit longer.
I'm Dr. Muleman.
I'm Dr. Mehta.
And we'll demonstrate three possible dressings you might have after your ear surgery and the way to remove them. If you've had a surgery through your ear canal without an incision behind the ear, your dressing may include a band-aid and a cotton ball. 24 hours after surgery, you can remove the band-aid and cotton ball from your ear and replace a new cotton ball into the bowl of your ear. You can continue to replace the cotton ball with a new one as needed when the cotton ball becomes saturated. All the areas that are colored green are okay to clean as needed. The area colored red with an X through it is the only part of your ear that we do not want you to touch. If your surgery included an incision behind the ear, your dressing may include a cup dressing, fluffed up gauze, a telfa dressing on the incision behind the ear, tape on the incision behind the ear, as well as a cotton ball in the ear canal. 24 hours after surgery, you can remove the cup bandage as well as the fluff gauze. Next, you can remove the telfa dressing behind the ear, taking care to leave the tape in place over the incision itself. You can remove the cotton ball from your ear and replace with a clean cotton ball. You can continue to remove and replace cotton balls as needed as they become saturated. All the areas that are colored green are okay to clean as needed. The area colored red with an X through it is the only part of your ear that we do not want you to touch. If your surgery included an incision behind the ear, your dressing may include a gauze wrap around the head, fluffed up gauze underneath the wrap, a telfa placed over the incision behind the ear, tape placed over the incision behind the ear, and a cotton ball in the ear canal. 24 hours after surgery, you can remove the head dressing by carefully cutting the dressing with scissors. You remove the dressing itself, as well as the overlying fluff gauze. Next, you remove the telfa dressing from behind the ear, taking care to leave the steri-strips in place over the incision. Next, you can remove the cotton ball and replace with a clean cotton ball as needed. All the areas that are colored green are okay to clean as needed. The area colored red with an X through it is the only part of your ear that we do not want you to touch. For showering after surgery, ask your doctor. In general, all the surgeons will want you to keep the water out of your ear canal. To do this, you can take a cotton ball and cover it with Vaseline to seal the ear. For all surgeries, no lifting more than 10 pounds until after your first follow-up appointment. Take care to sneeze with your mouth open and do not try to pop your ear. Your hearing may be temporarily worse after surgery. You should expect some bleeding from the ear canal as the packing dissolves. This is the reason for replacing an old cotton ball with a new one as needed. You should expect some pain around the surgical site, which should get better every day. You should expect some numbness around the incision site, which will improve with time. You may experience some taste changes towards the front of your tongue. This also will improve with time. Things to look out for: extreme dizziness or total hearing loss. If either of these problems occur, please call us at the office. Incision problems include redness beyond the incision itself, warmth, or drainage from the incision site.